Meanwhile, just weeks after bowing to public pressure and rolling back its strict zero COVID policy, China is seeing a rapid COVID surge. The government has stopped publishing daily data, but top health officials estimate as many as 250 million people were infected in the first 20 days of December. 250 million, with as many as 5,000 dying per day. Experts say up to 2 million people in China could die from COVID by the end of next year. To discuss this Chinese surge and its potential impact here at home, we're joined by Dr. Rimoin, epidemiologist from the UCLA Field School of Public Health. Dr. Rimoin, thank you for being with me tonight. So you just heard the latest. I know you've been following China closely. We've relaxed our policies here. What does the situation in China mean for us here? Can we expect a similar surge?
Well, you know, the epidemiologic landscape in China is very different than it is here in the United States. You know, they've had very restrictive policies for the last 3 years, which means that there's very little immunity in the country. Furthermore, their vaccine technology is less effective than the technology that's been used here in the United States and elsewhere in Europe, other places. So therefore, there's really a very low level of immunity in this country. Little infection, little good immunity from recent boosters. So we're seeing this massive surge. Could we see the same thing here? It's very unlikely. But what I have said to you before since the beginning of the pandemic, an infection anywhere is potentially an infection everywhere. And this massive surge of cases could result in a new variant that could cause us problems as well.
That was actually going to be my follow-up question, because that is always the big concern if we get another deadly variant, because thank goodness Omicron has produced less severe illness. So we don't want a new variant. What are the chances of that happening when you have so many infections?
Well, every time you have a new infection, there's an opportunity for mutation and a new variant to arise. You know, it's a roll of the dice. There's no way to know what's actually going to happen. But what we've seen before, when we see these massive surges, we have seen new variants evolve over time. You know, we saw this with Delta. We saw this with Omicron at the beginning. So anything could happen. But what we know is, just when you let it rip, when you see so many infections all at the same time, it's a lot of rolls of the dice that could result in a new variant that could cause us a problem.
All right, do you have your crystal ball with you?
I don't. My magic 8 ball says, you know, all who knows, but it's a good idea to keep an eye on it. And sequencing is going to be very important in reporting the data, which we haven't always had in this scenario when it comes to China.
Okay, well, I was asking about the crystal ball because I want you to just kind of look ahead to January and February now that we're at the very end of 2022. I mean, it was nice to hear that we have moved back to the medium community level from CDC. We know that we could go back into high because we just gathered for Christmas, and now we have New Year's coming. And of course, it's not just COVID. You know this. We have flu, we have RSV, we have the common cold. So looking into that crystal ball, how do you see the next 2 months looking?
Well, this is a time where we often see a lot of respiratory infections happening and spreading in the community. I mean, that's not new. That was happening before COVID. That's happening now. So people have been gathering. We've had a lot of travel, a lot of people stuck right now with travel here in the United States. So, you know, we could see a lot of respiratory viruses spreading, and we won't really see the effect of that with testing and illness and hospitalizations and eventually deaths for a couple of weeks, right? You have to have time for this to spread. It's going to spread in populations. People are going to get tested. People will end up hospitalized, and then we'll see the other end of it. It's always a path that we follow here. So it's really to be determined.
Okay, well, you can still order your free COVID tests for more. You can go to, I believe it's covidtest.gov. I know that you put that on your social media as well, and we've reported that here at Fox 11. Dr. Rimoin, thank you, and happy anniversary. I know you and your husband are celebrating your 8th, so I hope you have a very nice, loving, celebratory evening.
Thank you so much. We will.
Stay safe and healthy.